in progress.
Good day and welcome to another of our series in Battlefield for Our Mind. And I'm really pleased that Reverend Dr. Trevor Adams is joining us for this dialogue. And on this particular occasion, we're going to focus on community empowerment, or Dr. Trevor as a community empowerment advocate. And our theme this evening is around community stewardship and servant leadership. The Battlefield for Our Mind series is has a focus around communities of practice. So we work with the community in terms of its best approach for community mental health resilience. So we will be looking at what the community does for itself as it relates to mental health and well-being resilience. So the actual series, Battlefield for Our Mind, involves an advocacy systems approach to quality, compassionate care for long-term conditions, taking into account a person's cultural, economic, environmental, social, and spiritual needs. So Reverend Dr. Trevor Adams is one of our Wellbeing Faith Cluster champions. And the key words around this initiative are patience, compassion, respect, endurance, and faith. That's patience, compassion, respect, endurance, faith. And those 5 words actually, as symbols, donate the term PCREF. At the moment, PCREF is the NHS England mandated programme for community-led and systems-supported mental health programmes across the country, with a particular focus for African and Caribbean population groups. And this programme, PCREF, originates from the Mental Health Act Review recommendations. So what we're doing is aligning the community-led activities with the system care pathways. And that's why the role of community empowerment advocates are so important. So that's really going to be the essence of the dialogue with Reverend Trevor. And to give, for this particular dialogue, there's a spiritual context. So we are promoting practical theology within neighborhoods for sustainable communities. So that involves the fostering of a sense of interconnectedness, addressing local needs through faith-based initiatives that empower members of our communities through education, skill building, and encouraging environmental social justice. And all of this is being integrated with the spiritual values, with tangible actions. So we describe this as inspiring, inclusive, peaceful, caring, and enterprising neighborhoods and sustainable communities that are upholding the values of respect and inclusion as the common ground for all, regardless of background, culture, status, or location. So I'm really pleased you're here, Trevor.
I'm glad to be here. Glad to be here. I've been waiting excitedly all day for this evening.
Thank you very much. So Trevor, before we get into our dialogue, just tell us a bit about your professional background as it relates to activities within the local communities that you serve. And of course, we know you're Bedfordshire, Luton and Milton Keynes, but you've also got a national and of course done international work as well.
Yes. If I can link it to the idea of the concept of servant leadership, it started off basically with a desire on my part to want to make a difference to people's lives and to our community, looking at different ways that I could serve. So I saw the different needs within the community. And then from seeing the needs, looked at what it is that I could do to have made a difference, drawing together all of my skills, background, experiences, etc., etc. And over the years, there must have been about 15 different projects that I have initiated within the community to address specific issues. So the first one was around domestic violence. So identify that there was a need within the community for a different approach to domestic violence, working with the perpetrator and working with the victim of domestic violence, and look at ways that change could have been brought about. So I started off with that. And then from there, I'd set up a project that looked at mental health advocacy within the Black community. The project was called Dignity, because I recognized at the time that the mental health legislation was a powerful legislation that actually could take away a person's rights and dignity, especially if somebody was section. And it was roughly around the time when David Rocky Bennett was held down and suffocated, and his sister, Dr. Joanne Bennett, started the process of looking into a public inquiry into what had actually happened. From there, another project was around looking at the education of Black children. Again, identifying that the education pass rate for Black children was quite low. It's still below the national average. It still is after all of these years.
Mhm.
Again, looking at how to address it by devising and developing a project as part of the National Black Boys Can Association, to deliver a project in Luton linked to the National Black Boys Can Association, but also set up a project around the achievers. So the estate where I live, for example, local school and the education authority at the time, children were only 23% of Black kids were getting 5 or more GCSE, 23%. And so along with colleagues, we worked together to raise the performance of Black kids through the Achievers Awards project. Again, work with family, work with Sure Starts, again, from a community perspective. And the list goes on and on and on. That's from a practical theologian.
Mhm.
Practical theologian identifies what the needs are in order to bring about change.
Yes, absolutely. And you mentioned about Rocky Bennett, because in fact that was that program was the catalyst for the original Battlefield for the Mind program,
Right.
hosted by Church of God of Prophecy.
Yeah.
Quite a few years ago. We're now talking about 2008, so
Yes.
a good while ago.
Yes.
And as I mentioned, the recent Mental Health Act review um, still has at its center about reducing compulsion and improving the rights and choices of people who are detained.
Yes.
And one of the key areas in that particular review is why still so many African and Caribbean people are held, you know, in the mental health system for the safety of themselves and others.
Yes.
So much of what we intend to do through the programs, PCREF and programs such as this, is to focus on the intervention of our community and to look at the ways that we have been effective in the past and how can we build on that, scale it up, improve collaboration across the community organizations as well, and move to what we call a co-production model, co-production, co-design, co-learning. But that really has to happen in the community before the community can really press the care system, mental health care system, much harder to improve access, the quality of experience, and of course, the overall outcomes.
Yeah. And it's quite interesting that you said that, because when we started off, there was little attention paid to the importance of faith. In fact, it was almost, well, we'll work with you, but leave your faith outside of the door. And we, as part of our projects, we did some research. We recruited volunteers as part of the NIME, National Institute of Mental Health England, looking at a different way of approaching mental health, and which was very much about engaging local communities, training up community with research skills. The community would identify what questions they wanted to ask, what were the issues and what were the concerns, and it would be the community who did the research. And that is what we did. We did the research with a group of volunteers from my local church, and they identify that faith played a very, very important part in people from our community, their need and their well-being, which then drew to the attention of the health authority that you really, really cannot exclude a person's faith from understanding how faith plays an important part in their well-being.
Absolutely. And of course, and we need the institutions of faith to be heavily involved, because they understand and they have access to our families, our communities, our young people, and some of the challenges that our communities are faced or do face. So, of course, people such as yourself to be involved in this level of capacity building. And post-COVID, we actually need to reconfigure how our institutions and structures approach mental well-being of our communities. So could you say a little bit more around your thoughts for the future around young children and young people and families? Because one of the positions that we're now taking, we're saying, yes, there is this children and young people focus, but we need to link families as well. It's not seeing them in isolation. A few years ago, the Home Affairs Committee said that any provision for young people in this country should have three key themes: attitude, aspirations, and attainment. But as I say, but we're now saying for a holistic approach, it needs to be linked to their families. And of course, families in the wider sense, the spiritual and care families, you know, the faith communities families are an important connection to that. So could you give us your perspective around some of how maybe what you would like to see in the future?
Yeah. Yeah, thank you for that. I think the authorities perhaps belittle the importance of families in terms of a person's mental health and a person's well-being, and as it relates to children. It is it plays a very, very important part because it's within the family where a child learns the resilience. Because within the family, the child has different models presented to them. And within the wider family, say, for example, within a church family, the child has access to a wider range of different people. But one of the important things that family provides is a sense of belonging. I belong, and a sense of identity. I belong, and I belong to this particular family. This particular family helps me to discover who I am, what I'm all about, and how I relate to the world. Now, especially since COVID, we have seen it rocketed in terms of children and their mental health and well-being. We know that there are many children who haven't returned back to school, and therefore the family plays an even more important role in terms of stabilizing them and ensuring that they get the type of education that would enable them to live a fruitful and productive life. So I certainly think that there needs to be a strengthening of the family. You probably remember that probably, I don't know, about 10 years ago, the strengthening families,
Yeah.
strengthening community program, which even by the name itself says that you strengthen communities by strengthening families. You strengthen society by strengthening families, strengthening community, etc., etc. So there is a need for work to be done around how do you build the capacity of a family? How do you help them to overcome the challenges? What strength do they have as a family? What strength do they have? One of the projects that I initiated, used to run in Luton, was family group conferencing. Family group conferencing. So if there was an issue affecting a child, you would then tap into the child's family and wider network. So the child's family, family friends, uncle and aunts, etc., etc. And they together would be take the lead in looking at what the problem was, but also what the solution was. And then they would take responsibility for implementing the solution. So the family group conference was a way of the family and the wider community addressing the concerns around the child. They not only would they be part of the solution, there was the solution. And I recall a time where this child was going to um, well, child parents couldn't look after the child, but the grandparents stepped in, and you had kingship care. The grandparents stepped in. The grandparents were now becoming elderly and found that they couldn't continue looking after the child. So what happened? We called a family group conference, and our auntie stepped in and said that she would have the child. But it wasn't just simply the auntie, it was the whole family supporting the auntie to support the child. So I would like to see that. I'd like to see more family group conferencing approach to where the family, what the family has, its strength, um, its resilience to help child. Now, so resources invested in strengthening the family would lead to long-term sustainability, because you build the family, you would be able to put in place long-term sustainability. If you put a child in an institution, then that child is only part of that institution when the child becomes 17 or 18.
Mm-hmm.
You know, child 17, 18, then that child leaves. So things like family group conferencing would be really, really great. I also like to see the churches looking at how they support families, playing a role in understanding how they can come alongside mums and dads, aunts and uncle to support the child. Because we say, we say it takes a village to raise a child, but where's that village? Is it at the end of a telephone? You pick up the phone and you say village. Where's that village?
Yeah.
I think the church is able to be that village within which a child can grow.
And as you mentioned the church then, Trevor, and there's two things about that, of course. And as you kind of alluded to, we use that term a lot. It takes a village to bring up a child. And we hear that. Most dialogues stop there.
Mm-hmm.
But in fact, as an old African saying, the second part to that says, or the child may burn down the village
to feel its warmth,
to feel the warmth that it
yes,
deserves.
yes.
And so we conveniently leave that out because that's where our part two is our institutions.
Yes.
And because we haven't named our institutions that are really responsible for that, there hasn't been that focus. And why it is important in terms of faith communities and churches, faith organizations, because historically, these were the institutions that humans used for protection and well-being, education, hospitals,
Yes.
and things like that.
Mm-hmm.
Governance structures and other kind of nations came many hundreds of years later. So it's going to be how we are able post-COVID and the needs of the 21st century young people to reconfigure these institutions and structures and systems that exist in our communities and all the resources that are there that are unused. And this is where, of course, we come to the servant leader. And that's why people such as yourself, we regard as community stewards and also servant leaders. And just one key part of that, the servant leader, as described by Robert Greenleaf, that we use continually. And we say or what he says is about the servant leader, and I'll just read part of it. The servant first makes sure that the other people's highest priority needs are being served. So other people's highest priority needs are being served. So are our collective institutions doing that? But we need to do better, whatever it is that we're doing. We need to improve the collective impact. And it only comes from collaboration within our communities. And research done over the last couple of years, even our own communities want to see our professionals, greater collaboration from our professional groups. We look at the intersectionality of the African and Caribbean communities. We have one of the highest levels of professionals working in the mental health system, working in the education system, but it's not reflected in our own community structures and the impact that would have if there was a greater level of collaboration. But yet at this generation, we have the most academically experienced, working all over the world people, all over the system. So there's a conundrum there in terms of the spirituality that is associated with this progression that we've made. And then it also goes on to say about the best test and difficult to administer is do those served grow as persons? Do they, while being served, become healthier, wiser, freer, more autonomous, and more likely themselves to become servants? So, of course, having benefited, taking us as the Windrush generation, or, our parents coming over as a Windrush generation, the sacrifices they've made, the sacrifices that we've made as a generation. And now, again, have enough of us become servants that we then will turn back and think about the effect on the least privileged in society, and will they benefit from the progression and the leadership and all the opportunities the generation before has made. And key thing, what it says at the end, or at least, so if you're not particularly sympathetic to looking back and helping the least privileged, or at least will they not be further deprived?
Right.
So in other words, will we contribute to the systemic health and education inequalities that we're always reading and talking about?
Mm-hmm.
So as you can see, so that puts quite a spiritual challenge to our or a challenge to our spiritual leaders. So I'm going to hand that back to you now to
thank
give
you.
a perspective on that.
Yeah, I think what it is that oftentimes people's theology does not translate into everyday practical action.
Yes.
So, people of faith may read the Bible, but then how does that relate to community empowerment and community development and community transformation? And how do you do that as a leader? And as you rightly said, that Greenleaf says that you first of all start off by having a strong desire to serve.
Yeah.
But if you don't have that desire to serve, but you want to be a leader, then it all becomes about self-interest, as opposed to the wider community. So going back to one of the things that you mentioned that I would love to see, I would love to see that more people doing training around servant leadership. What does it mean to be a servant leader? And the 10 characteristics of servant leadership, which involves not only empathy, but also healing within a community, bringing communities together. And I think because people probably aren't so aware of the servant leadership model as it operates in modern times. I mean, for example, Disney, the Disney company is an example of servant leadership, where their first and foremost purpose is happiness. Happiness. That is their thing, creating happiness. People to be happy, and everything else is centered around that. Their values, courtesy, safety, respect, all of those particular things. And so once we understand how to bring about change through serving, then we are in a better position to look at how we lead. But it starts, as Greenland says, it starts with a desire to serve. I think lots and lots of people probably want to make a difference and expect there to be some sort of lightning in the sky come down and a voice behind a rock says, "You are the one," as opposed to, is there something in the heart that says, I want to serve my community, and how can I serve my community better? And servant leadership becomes the model by which we can become better at serving, enabling other people, empowering other people, training up other people, developing other people so that they can become servant leaders. I remember in one of my lectures, a student asked me the question, why is it that we have had people like Gandhi, people like Jesus, people like Nelson Mandela, who impacted Mother Teresa, who impacted the world in a very, very positive way as leaders, and then why hasn't that continued? Why hasn't that continued? Why hasn't that idea of servant leadership continued? And once they began to gain a better understanding of what servant leadership is, they realized that actually it goes contrary to the predominant view of what leadership is.
Yes.
The leader is the boss who sits at the top and drives everything, as opposed to the leader serves. Mother Teresa just served. The poor in Calcutta. Nobody came to her and said, look, I'm going to send you to Calcutta. Her desire to serve. And when we look at the situation within our community, the inequalities, the iniquity around mental health, there is enough evidence out there to say, look, we cannot allow things to continue the way that they have for all of these years. And you mentioned about mental health in the Black community. Now, I recall that especially young people, that the pattern was that they would end up in a mental health system by the courts. By the courts, they will end up in a mental health system by the courts. Plus the issues around diagnosis. So if we are stressed and we say we are stressed, that's often overlooked. Or if we're depressed, that's often overlooked. And our behavior is often diagnosed as schizophrenia, the extreme ends.
Yeah.
And all of these things can only be changed by us as a community coming forward and setting up and taking charge of our destiny by looking at the resources that we have and beginning to use the resources that we have. So the starting point, what resources do we have? As you said, we have the professional, and in some cases, we've got building. We have got the resilience because we've been around for 75 years. We've often have the financial resources. So it's looking to sort of see what it is that we have. But oftentimes what is missing is that passion, that compassion, that desire to serve.
Absolutely. And relating to the role of mental health and spirituality, I mean, this is what the Institute, the Royal College of Psychiatry actually said.
Mm-hmm.
Spirituality involves a dimension of human experience that psychiatrists are increasingly interested in because of its potential benefits to mental health. In healthcare, spirituality is identified with experiencing a deep-seated sense of meaning and purpose in life, together with a sense of belonging, as you stated earlier on. It is about acceptance, integration, and wholeness. And in surveys that have been done in the past, and we're about to launch a survey around mental health as well as part of Battlefield for Our Mind, some of the results have shown that what people have requested, regular quiet time for prayer, reflection, or meditation, sorry, not mediation, meditation, of course. Appropriate study of religious and or spiritual material. That sounds like the Bible to me.
Yes, yes.
Engaging in supportive friendships with others, sharing similar spiritual and or religious aims and aspirations. So that's the Royal College of Psychiatry.
Mm-hmm.
It then goes on to say, there are improved outcomes for service users when there has been a focus on the spiritual dimension, including improved self-control, self-esteem and confidence, faster and easier recovery achieved through both promoting the healthy grieving of loss and maximizing personal potential, improve relationships with self, others, and with God, creation, nature, a new sense of meaning resulting in reawakening of hope and peace of mind, enabling people to accept and live with problems not yet resolved, People need a time, a place, and privacy in which to pray and worship, the opportunity to explore spiritual and religious matters, and encouragement in deepening their faith. So this is from the Royal College of Psychiatry.
Mhm.
So there's no reason why the institutions, the faith institutions within our community, uh, uh, don't have, or let me put it around, a more positive way. There is good reason for
Mhm.
the institutions, structures, and systems within the African and Caribbean communities to start to reconfigure the way they work and the way they link with the community. So co-produce, co-design, co-learn, which are at the very essence of what our communities are asking of the system in general. So in other words, it's about how we get our institutions to uphold those same values that we're advocating for on the general equalities agenda. And it's just
Yes.
not health, it's education as well. We have literally thousands of educationalists in this
Mhm.
country. So the challenge from a servant leader perspective is, how do we get those individuals to collaborate within themselves, within the communities, reach a consensus about serving,
Mhm.
identifying what the key priorities are to improve the educational well-being and development of the community. We
Yeah.
have the same with the health sector. We have thousands of clinicians, thousands of people in the medical workforce, and now we have thousands of people who actually work in the organizational development part of the system, as you know,
Mhm.
project leaders, program managers, all those skills that exist. So how do we translate that into improving the wellness on the community from where they've come from?
Yeah. I think you've just really sort of laid a foundation for that. It is about education. It's about being aware that actually there is research done. There is a reputable organization like the Royal College of Psychiatrists that identifies. I mean, we know, those of us who have the experience, we know that faith has played a very, very important part and continues to play a very important part in our well-being. Um, it's really the institutions, the public health institutions that have put up the barriers. And so, for example, if you have a local church that says, we want to be involved in addressing mental health, but we don't have the resources. And when they would want to go and apply for funding, they see this sentence that says, we do not pay for faith activities, right? We do not fund faith activities. So that in itself is a massive barrier. And then what we have to do then is to reconfigure what we mean by faith activities. So you're mute. You're mute.
But also, Trevor, what needs to happen is that this is where the community collaboration comes in. Because when we talk about co-production, it's going to be for our churches and our community organizations to sit down and collaborate and reach a consensus, so that the areas where the community organization goes forward and with the church's support sets out their program of activity for the well-being of the community, and there's going to be improved outcomes for the beneficiaries from that collaboration. There would be a positive system response. I think the challenge, so in a sense, what you described there, in a sense, is, let's say, the pre-COVID model of silo working.
Mm-hmm.
Each of the institutions and community groups in a particular area, in a local authority area, trying to do their own thing. And of course, they get played off against each other.
Yes.
They're all targeting the same communities, but not having the evidence to demonstrate the impact their activities are having. Because no one organization has all the skills that they need.
Yeah.
You know, and so going back to our earlier point, so how do we get those groups to understand that to improve the community impact, they have to serve by pooling their resources and working together?
Yes. Yeah.
So we've kind of got to flip it on the head in
Yes.
terms of the
Yeah.
thinking.
Yes.
Right? With the spirit, so it's a spiritual sort of way of looking at it, because the structures are not changing, the systems aren't changing. So it's a mindset. We're going back to the attitude of mind now. And we're talking about our professionals. So if you look at the intersectionality of our community, we have a lot of professionals in the health business, have a lot of people working in mental health. So where are the collaborative structures demonstrating that we understand and will take care of the community's needs with system support? So that's why we talk about community-led, system-enabled.
Yeah. Yeah. I think you know, again, we know that change starts off with awareness.
Yes.
Awareness. And I think if we recognize how many years we have been told about inequalities in health, it clearly says that the existing system is not working. It's not working. And therefore, we can sit back and think, well, let's continue to fan the flames of the existing system for the next 75 years. And I think this is where servant leadership comes in, because servant leadership, through the collaboration, starts to think, what picture of the future do we want to see? So we've had plenty of examples of the past, how the past has been, but can we start to imagine? And faith community have got a way of seeing beyond the limitations of today. And I think it's being aware, and then through collaboration start to collaborate around what would it look like across the three counties. What would it look like in terms of the future, where mental health is issues around mental health are being able to be addressed, that people feel a sense of belonging, that if they have an issue, then they feel quite comfortable to come along. Mental health still has the stigma.
That's right.
So addressing the stigma around mental health, the stigma that affects us talking about our mental health towards each other, the stigma of churches perhaps not engaging or allowing the conversation to be held around mental health without seeing it as the person is demon possessed, right? Also, looking at how then can we start to look at the policies. So awareness, a policy, changing the public image of mental health, because if it's something like 1 in 4 of us are going to have some sort of mental health challenge, whether it's stress or whether it's depression, it's very, very high. Mm-hmm. You know, if 1 in 4 of us was going to experience a broken leg, everyone is going to start to pay attention. But when it comes to something you can't see, and yet it has a big impact on our life, we are not,
of course, every aspect of our life. So
yes,
what I would say then, the position that you're moving to, as I would see it as somebody who's responsible for policy implementation, would be for our communities, institutions, to start to make the case for mental health promotion. we recently did it around the prostate agenda. So what we said was, we're promoting prostate health. We're not promoting the condition that we're all fearful of.
Yes.
So it's about reframing mental health promotion is good for our well-being. So what are the aspects of our lives that are good for our well-being? So that's what we've now got to think about, and that's what we are thinking about, particularly with the program I mentioned called PCREF, which will be around all different communities, because the program has been mandated by NHS England. But like I said, our community has a responsibility to also take care of itself. And our institution structures should be thinking about that for ourselves. And the carers, and maybe you could say something about the carers, because as you know, the carers are very often overlooked, and of course they can become ill themselves because of that constant wearing down of caring. And a lot of people don't notice. They just say, oh, they're coping well, then everybody walks past, as opposed to saying, actually, they could probably do with some respite. So I'd be interested in the perspective from that as well.
Yeah, I think being a carer myself, I've come to understand caring responsibility from a totally from my own lived experience, and having to work through when you are caring for a family member, you don't necessarily, first of all, think of yourself as a carer. You think you're looking after that family member. The second thing is the challenge of caring, the emotional impact, the changes that your life undergo as you become a carer, and your life becomes intertwined with that person who you're caring for, and oftentimes your own health and well-being takes second place. And we know that oftentimes we have a secondary crisis because it's the carer that ends up not being well.
Yeah.
And I think again, I think churches need to start to be thinking about people within the churches, within the community, who are carers, and what can be put into place to support people who are carers. And how can the churches make people who are carers feel welcome at home, and that it's okay to talk about those challenges that you are feeling, because it can be very, very isolating, very lonely, if you don't have somebody around you can appreciate what it means to be a carer. And of course, churches can provide the space, the platform for carers to come together. And I think
host the support groups.
Yes. And I think if I'm honest with you, I think it would have been an area that I would have overlooked many years ago as a pastor. It would have been an area that I would have overlooked. I knew people were carers, but I didn't really appreciate or understand what it means to be a carer. You would see somebody come to church and, the person looks okay, praising the Lord, whatever. But actually, what happens when they leave church? Is there a follow-up? Is there pick up the phone? How are you doing? Can I come and support you in X, Y, and Z?
That's a good point, because all of us would have looked at and will look at people helping people into church to sit down, and we always see them do that. And we don't think of the carer in that context.
Yes. Absolutely. Yes.
Journey. So the journey, that journey in the morning from home, because when we talk about the patient journey
Mhm.
system, the patient journey starts at home. What's the
Mhm.
challenge? What are the challenges at home in order to make the journey? So if you think we're seeing the person as they sit down, that's at the end of the journey just to get there. How did they get there? What were the challenges week in, week out that
Mhm.
they face? We don't think
Yeah,
about that.
yeah, we don't, and I think those are kind of things which we need to start to think about, because we are in a position where there could be a very slight change
Mhm.
um, to the way that we support people. Because the point that you made near the beginning about the pastoral care, so pastoral care, whether it's schools or whether it's the health service, all of it came from the church's idea of the care of soul or the cure of souls. So we have somehow taken a step back, belittled what we offer, and said, well, actually, we're not professionals. And yet we know that if somebody is in distress, that sometimes just a friend in conversation can make a difference to that person's well-being.
Absolutely. And somebody has indicated that some people would not necessarily be happy that churches are involved. But what I would say to that, and I've seen it many times, there's been many great initiatives within the health system, and people don't actually realize behind those social action agencies are churches. It's just
Yes,
that in the modern day times, they, you know, and that appropriately, you've got people with professional skills, qualifications, and experience utilizing their skills through agencies. And the people who need the help never turn down wherever they're going to get the help from.
mm-hmm.
So that's really important point to make. People will be
Yes,
very surprised if if they were to follow back some of the great initiatives that we've all benefited from, will
mm-hmm.
go back to people, you know, who believe that there's something more they should be doing with the resources. And of course, the resources that church have are from the community, the very same people who need support anyway. The church is
Yes,
not a separate institution from the community. So as we
yes.
say, the church is the community and the community is the church.
Mm-hmm. And I think there is no doubt that church can get better
Mhm.
at looking at the way it cares for people, because it's understandable why some people may not feel that the church should get involved because of um, church, how the church may have approached certain things. But as you rightly said, you look in the church, you have people who are professionals, doctors, social workers, nurses, counselors, offer those care to people in the wider community. But for folks within the church, they kind of feel that my skills will not be welcome here, and therefore I don't offer my skills here. And whereas the church is still a community.
That's right. That's right. So, Trevor, as we draw to an end
Mhm.
to this part of the dialogue, and we're going to allow some of your guests to give their perspective specifically on what we've been talking about, because that's the subject matter. Can you give me what are your top three issues that you would like to see addressed, that should be addressed, and why, in terms of what we've been speaking about?
Okay, number one would be uh, raising awareness,
Mhm.
raising awareness of the issues that are here, and what can be done towards addressing those particular issues. But raising awareness would be one. Secondly, pulling together like-minded people who want to collaborate around what practical steps, what action can we take together
To build that
to
consensus. It's a
build that
consensus building we
consensus.
talk about.
Yes, yes, within a community and within a community, and um, the public health services.
Mhm.
And the third thing, so the first thing would be around awareness. Second thing would be around building a consensus. And the third thing would be around looking at what resources do we have,
Yes.
identify what resources we have
So
that
making
can lead.
best use of existing resources.
Yes,
Yeah.
yes. So whether it's people, whether it's
Mm.
knowledge, whether it's buildings, whether it's relationships, what do we have and how can we start to utilize that? And then the gap. Where is the gap? What is it that we don't have?
Mhm.
Um, and how can those gaps be filled? And this is where the conversation comes in with the health services,
Yeah.
the ones who've got
Yeah.
additional resources but don't know how to utilize
Yeah.
those
And
resources.
this is where we connect into the co-production, co-design, and co-learning.
Yes,
The systems need to actually understand the culture as well that they're dealing with. And it's from all
yes,
backgrounds, because you can be from the similar cultural background and not understand how particular people are living, even though you may come from the same population group.
yes. And I think that was one of the things that came out of the David Rocky Benny public review. The fact that you cannot treat everybody all the same because they're black. You know, somebody may like rice and peas and chicken, and some people may like McDonald's. So you cannot assume that because a person is black or because a person from this particular country that this is what they would want to eat. Yes, absolutely.
Okay, excellent. Thank you for that. And we're now going to give any of your guests, if you'd like to call anybody out, to give a perspective. You've done very well. And thank you very much for your contribution. It's been very deep and clear. And I think will contribute as we start to think about the practical policy, community policy implementation around this way of working, using
Mhm.
communities of practice, put the issue in the center, and the three areas that you've identified around awareness, which is essential, because once you build awareness, you can then, the next step is your community understanding,
Mhm.
ensure people are informed. And from there, you can then move to the call to action. You know, what do we want people to do? You can
Yes.
establish the call to action through your communities of practice. You build a consensus, group of people building the consensus and then working out amongst themselves what the priorities are.
Mhm.
They're the priorities. Again, you can then focus on what the call to action is. So, you know, it's an excellent way of us approaching this really, really important issue.
Yeah. Anyone want to any feedback, any question would be really, really helpful as we've started the conversation. So if anyone's got any questions, any comments, any observation.
Right. So you've been let off, Trevor. You've
Yeah.
been let off. So before we go then, Trevor, is there what's your lasting remarks? Just give us your final remarks on what we've been talking.
Um, well, really, thank you very much for putting this on and facilitating this conversation, because I think it all starts with a conversation,
Mhm.
open, honest conversation. That's part of the awareness raising. Um, as you are aware, there's been reports into inequalities across the three counties.
Yes.
Um, And I think this provides us with a unique opportunity to say, okay, how do we raise awareness around this? What is it that we need to do to start to collaborate
Yeah.
and develop a consensus? And then what do we need to do in order to move towards a call for action? So some very, very practical steps that you've outlined through this conversation. But then I think it's about ownership.
Yes.
Who would own this? And it comes back to that serving. I serve because I'm owning this. It affects my community. It affects me. It's not something that I'm talking about, something that is in another country.
You do have
It's
agency. You do have
yes,
agency. And
yes,
that word is
yes,
banded around a lot as though there isn't agency, when in fact
yeah,
there is. Because sometimes if we separate ourselves from upholding the same values that we're advocating
mhm,
for ourselves by the way others treat us, and we do have a collective responsibility about how we treat ourselves.
yes,
It's kind of obvious, but you know exactly what I mean in terms of collaboration, trust, cooperation within our communities, within our community groups. So we can keep reading the inequality reports, but in those reports do need to indicate, so what is the state of the collaboration within the African and Caribbean communities themselves, and where they are collaborating and making a difference, that needs to be recognized so it can be scaled up and used as case studies. So
yes,
one of the things I look for in reports is to see if there's any indication of any collaboration within the population groups that the report is saying is being affected by inequalities.
yes.
Because
Ah,
sometimes what that will mean if you don't see it is that there's system indifference. So you then have to go in and work out and find out, well, is the community collaborating within itself and not being recognized? So again, we're back to, well, we need to raise awareness then.
yes,
And if the community groups aren't collaborating within themselves, within a particular area, then that's the action, the servant leadership action is the intervention from within
yes,
the community to address that as an issue. You put that at
yes,
the center. So at the
yes,
center of a community of practice dialogue is that let's have a discussion about how we collaborate. What are the issues? Lay out the issues.
yeah. And I think I'd probably just add to that. The Change Makers program was involved with the Change Makers program. The idea behind the Change Makers program was to work with young people, for them to take action, for them to identify what issues facing young people, and
Exactly.
for them to take action to bring about change. And I remember working with a group of five, just five young people. And amongst themselves, they identified an issue which they wanted to address. And they developed a very small scale project that was meant to last for 3 months. That project has been expanded. And that project was around dealing with microaggression. So a group of five young people come together, working together, collaborating together. They've now developed a national reach around microaggression. So starting small with a willingness to serve begins to make a big difference. So, because I think people think, well, this just seems so enormous,
Yes.
and this sense of powerlessness, it just seems so enormous. What am I going to do? But by actually the collaboration means we're not looking to do it alone. It's us, it's we working together.
And that's perfect. And that's great that that was actually achieved by young people. And the reason being that when we think about the provision for young people. So earlier on, I'd mentioned about it was about addressing their issues or addressing attitude, aspirations, and attainment as themes, not addressing, but as themes in terms of provision. But also that relates to the pillars, the three pillars of young people need somewhere to go, young people need something to do, young people need someone to show them how. And if you haven't got those structures within communities, then why are they not there? So we're back to that collaboration again, going back to the village and keeping it warm for everybody.
Yes.
Because the resources are there.
Yeah,
But
there's one hand up.
yeah, I was going to say, we've got Belisa. Would you like to go ahead? You've got the hand up.
Yeah, yes. Good evening, all. Pastor Trevor, well, I'm so grateful for this session. And you mentioned about raising awareness, in terms of raising awareness, and you spoke about servant leadership.
Yes.
Is there training with regard to um, developing a servant heart, serving in the community, servant leadership training? Is that something that you or know of any such training?
Yeah, as you know, I lecture at college, and servant leadership is one of the things that I lecture on. If there is a need for training within the community, then Rudy would definitely agree with me. That is something that can be done, where we can provide that sort of that servant leadership training. You know, both stewardship and the servant leadership training. The servant leadership training, yes, it can be made available if we are saying this is something which we want to be involved in.
Okay. And how long is that for, the course?
How long is the course for? Well, when I teach leadership and particular servant leadership, it's normally over a period of 10 weeks. But training can always be adapted based according to different needs.
Yeah,
Okay.
and also what can happen is that if you're part of an existing organization or community group, and you want assistance of how to think about the challenges relating to servant leadership, or how you might translate that into what we call workable plans, projects and programs, then the capacity building support is there, but that's done on a bespoke basis. And so Trevor would be able to
Okay.
help with that, particularly if you are at the moment speaking from that Bedfordshire, Luton, Milton Keynes sort of sub-region, because there will be some
Okay.
provision, but in other parts of London as well. I guess what we're really doing is laying out or showing the landscape that exists within our community as is at the moment.
Okay.
Okay, so
Yeah,
the answer is
can
Thank
yes.
you.
yeah,
So,
and can just also add to that
yeah.
we will be meeting with Christ Redeemer College, the college where I lecture at. You know, this would be something which we can feed back to them, so that it can be looked at on a wider basis. But in the meantime, you know, this is something that could be done locally.
That's good.
Yeah, I mean, if there's enough people who would be interested in it and we've got the resources, then yes, that is something that can be done.
Yeah, I'll definitely be interested in doing something like that.
Okay, and also there's a lot of things that are done online as well. So there is online provision for this as well. And it would take the shape of this type of dialogue. But what we do, we put the issue to be addressed at the center. And there's a term we use, all voices must be heard. No ideas overlooked, diversity of opinion accepted, and finally, collective responsibility to take action. So, Annette, thank you, Felicia.
Thank you.
Hiya, can you hear me?
Evening.
Yeah, I can hear you.
Yeah.
What I was going to say was, especially around the young people, you're saying, how do we get the young people need help? They need to go places. They need somewhere they can meet up and stuff like that.
No,
but
if I explain what I actually said, Annette,
yeah, go on.
let
Yeah,
me
go on.
say what I said in relation to what Trevor said. Trevor said there was a group of young people and they initiated for themselves the self-help, which is a good thing. So, and then what I said was the pillars that we think about in terms of the provision for young people is that simply young people need somewhere to go. Young people need something to do. Young people need someone to show them how.
Okay, because we had a meeting like not too long ago, actually, and it was especially for young people to come and view the airs. But when they don't turn up to the meetings, what do you do when meetings are especially put on for them? Every time we hear about youth meetings and this, that, when you go, there's hardly no youth there. But at the same time, they're crying out for help.
Yeah, that again, that's not for this forum. But what I would say is that you then look at who's initiating, where's the young people's voice. So we don't like to stereotype the young people, but what I would say is when it comes to what we would call local matters, we've got to think about what are the activities, what's the past experience, who's doing the calling. There's a long list of things. So we don't take a broad brush as to why people turn up, because there's many adults that don't turn up. You know, we always joke about if you start doing programs around prostate health, diabetes, mental health, how quick the room clears, you know. But if we put on a dance with music and food, the room is full. So I think it's part of that is human nature as well. So we then have to think about what the where the interest lies and what's the involvement of the people we're seeking to influence as well. So again, what Trevor and myself have been heavily talking about, you may have identified, is involvement, not engagement, but involvement, and the involvement of our communities, wherever part of the community we're from, so that we improve the representation in our own interests. Because if young people need somewhere to go, they need something to do, someone to show them how, they need to be involved. They need to be involved in calling other young people, their peers, to be involved, such as the young people that Trevor was talking about in that model. So that's how I would answer that.
Yeah, because then we went to the meeting and they weren't even happy that churches, you know, they didn't even want us there, the church. They don't want the church being involved. So, but when it comes to anything in the community, the church is the people, it's not the building. They just can't seem to get a revelation of that. It's like the church, why should we involve the church? Why can't we just have a black building of our own? But it's about having black building of our own, or just getting involved as a community, you know?
Well, yeah, we do have a lot of contradictions in terms of, we're back to the collaboration within the community as well. And as we said earlier on about building a consensus so that we agree the way forward. So that there are challenges, as we've touched on, and there's challenges amongst our professional groups as well. We've seen it with our professionals not being able to create communities of practice for the overall collective impact on the community. So I think it's challenge that we have to embrace. Hence why, you know, we believe in the servant leadership model, because we can still get things done despite the challenges.
Yeah. Okay. Thank you.
Thanks for that, Annette. I mean, it's something that is always on the table. It's always an issue that we need to address as well. Thanks for that.
Because at the end of the day, we may see the need, but how do they actually see it? Do they see it as much as badly as we see it? For young and old, actually.
I'll let Trevor answer that one.
Because we're always having meetings, but the meetings are never full.
Yeah, I think this is where the servant leadership model comes into it, because lots of institutions, lots of organizations take a very paternalistic approach. In other words, we will do this for you. We know better. We know what it is that you need, and therefore we will implement this for you and invite you to come along. As opposed to servant leadership approach is, how can I serve you? What are your needs that are not being addressed? Where is their gap? And how can we serve you on your terms, as opposed to us serving you on our terms? So us serving you, you know, serving you on our terms may well be you come to where we are, as opposed to let's go to where you are and let's see what it's like being you and walking in your shoe, and what are the challenges. Because for us, it might be very, very clear, we've got a space here, come along. But actually, let's say a young person, for example, and let's use Luton as an example. A young person living in one part of Luton may not want to travel to the next part of Luton because there may be issues within the community that makes it not very safe for them to travel from one part to the other. So it may not be that they don't want to come along to a meeting. It is location. Where is the meeting being held? And what does it mean for that young person to get from point A to B, and to get there safely? But
and to get
we
home,
can only
to get home safely.
And to get home safely. And so we so hence the reason why servant leadership, the starting point is very, very different. It's very, very different. It's not about you know, we are going to do this for you. It is about us coming alongside and walking with that person, and then identifying what it is that person needs and how can we serve you. It would be like you going into a restaurant and the waiter, waitress is telling you, you are going to have this from the menu, you are going to have this from the menu, you're going to have this from the menu. You're saying, wait a minute, I don't eat that. Whereas a servant leadership says, well, we'll wait here. You let us know what it is that you are doing. What are the issues that really, really concern you? There's been lots of research done already around what young people see as their number one priority, and what they think is their number one priority, and may not be what we think as their number one priority. You know, young people think about the environment, right? They think about the environment as one of the issues. So it might be uppermost in a young person's mind is the environment. We are concerned about the environment.
That's such a good point, Trevor.
Yes.
Also, and what you're describing these days is the co-learning. So again, people working in the systems from all backgrounds, as you touched on earlier on, doesn't matter that people may be from the same population group, but they have to, from a co-learning, have to go into the community to actually understand what's the lived experience.
Yes.
And we mentioned earlier on about all voices must be heard.
Yes.
You articulated the point very clearly. So you have to go and talk to the young people in the environment where they are, then ask them what meetings do they want to attend? What is it that they want to see addressed? You know, and so it's a really different way of working, and it is challenging. A few years ago, before the London 2012 Olympics, there was a big survey done, again, Church of England actually was involved in that. And they said to young people, what is the number one thing that you like to see as the, London's the run up to the Olympics? And the overwhelming focus for the young people was peace. They said that that was the number one issue for them. Hence why we had that program called, Passing the Baton, Inspiring, Inclusive, Peaceful, Caring and Enterprising Neighborhoods. So again, having said that, so we have to find out from young people, what does peace mean to them? What does safety mean to them? And going back to your point, Trevor, safety may mean to them going somewhere very close to home because they feel vulnerable, or their parents will say, or their guardians will say, well, actually, you're not going across the other side of town. So there's no point a meeting being held over there because you're not going, or you may not, or they may not want to go. So it goes back to your point, we have to think about the lived experience of the people who we're seeking to attract and understand.
Yes.
That. We have to do that ourselves,
Yes.
let alone asking the system to do that as well.
What else?
Somebody said in the chat, Sandra, lived experience is our greatest teacher. It's a great point.
I would
you're experts by experience.
Yeah, I would say, and this is me with my educator's hat on, reflection on lived experience is our greatest teacher.
Yeah.
Reflection on lived experience is our greatest teacher, because we can have an experience, a lived experience, and we live in the same experience again and again. So, for example,
we learn.
Yes, if we know that our lived experience is that there's been inequalities for many years, that is our lived experience. Change can only start when we reflect on our experience and we see the pattern, and we see where we have played a part or haven't played a part. So lived experience only becomes our greatest teacher when we reflect on those experiences and learn from those experiences.
Yeah, that's such a great point. And in policy terms, we would say we're all part of the systems that we're seeking to change.
Yes.
And also, of course, we participate in the organizational culture as well.
Yes.
And sometimes we're seeking to change that, but we are participants in it as well.
And so we could either be part of the problem or part of the solution, because we are part of the system. So we either are a part of the solution, or we become the problem.
Yeah, because if you think about it, if we have a lack of compassion, lack of respect, and lack of kindness, and don't treat our own families and communities with humanity, then we are part of that problem ourselves, if there's stigma for whatever reason. And it's something that we do have to recognize.
Yes.
So this is your absolute final point.
Oh, mine. Okay, I've said my final point. I don't know. Yes, I think I've said enough. I'm a person who likes action, and I would just encourage anybody who wants to take things further, just reach out to me, or to yourself, Rudy.
Great. Thank you, and see you again soon.
Yeah. Thank you, everyone. Thank you very much.
Goodbye.
Speak soon.